what we know currently about COVID as we come into the fall of 21 and 22 school year. And so that, of course, was in board packet for August 9th. That was a publicly available document as well. But just would like to provide just sort of a high-level overview, quick summary, knowing that it's been out there anyway. But first, really felt like it was important to acknowledge our priorities, which are on the screen. From an administrative standpoint, and I know for you as a board, we last year spent a lot of time talking about these 4 priorities, and they remain the same. The idea that we really want to reduce risk for students and staff, don't want to expose people unnecessarily to certain situations. It was very important to the board that we try to balance the social emotional well-being with that of the physical well-being, which was to parents, frankly, in a really tough position as it comes to this virus. Also, that we wanted to the extent possible to really ensure that we were providing an environment where learning was going to be cohesive and coherent. There weren't going to be lots of interruptions if that was avoidable. And then finally, that we were working to really meet the needs of all of our students. So some of the discussion that we had last year, as you might recall, was relative to really focusing on some of our youngest learners and their ability to stay in school with us as much as possible. So as we sit here now, from a year ago, we made a lot of tough choices, but certainly I think we all feel like we got through it pretty well. As we look at this year, then the now versus the then, really I think this celebration here is that we've come a long way. As we look at the fall of 21, certainly is the intention that we have an in-person learning model. Last year it was hybrid. We do have more capacity in the schools. This is really exciting. With the new Karcher on deck to open its doors, we've frankly in our K-8 and particularly in our elementary level schools, we just have more room. And that capacity is a great asset now more than ever. And you can see some of the other things that we're excited about in terms of having everybody back, being able to hopefully do field trips and birthday treats and things that we once really enjoyed. And we hope that we're able to do that again as we fall into this school year. Also just wanted to sort of remind folks that are also with us this evening that one of our strongest abilities, frankly, to navigate this pandemic has been this idea of a very layered series of mitigation efforts. And so the best analogy is it's a little bit like Swiss cheese. And if you pile a whole bunch of those slices of cheese together, the more things that you're able to do, the harder it is to find holes that match up to get all the way through it. And so as you can see on this slide, this is just those things that we've asked people to do all along. If you're not feeling well, stay home, or the hand washing, the hygiene, and some of the deep cleaning and so forth. So this is still our layered mitigation strategy. We think it has worked really well for us up until this point. Did want to provide the board and community with information on what we have as a vaccination update, if you will. We are, this is now as an 8.3, it's even a little bit higher now, but at 84.5% of our staff are fully vaccinated. We certainly welcome students, if they are also getting vaccinated, that they could share those records with us at their convenience if they want to. Our local data, as you can see, we have what Racine County shares with us in terms of age groups. They are breaking it down, ages 12 to 15, that's kind of middle school, if you will, and then ages 16 and up within Racine County. You can see what the overall vaccination rate is for the county and the state of Wisconsin at just around 50%. This slide and the next 2 that follow are really just for your information. Again, these were slides that our Director of Health Services, Jill Drager, shared last month in her health update in summary of last school year, but really wanted to just simply share again that this slide is our local data for Central Racine County Health, followed by a slide that we didn't even have access to just a couple of months ago. And this is one that is coming from the Department of Health and helps us to see specific to our school district boundary, which exceeds beyond the city of Burlington into the Burlington area, and where we stand in terms of a positive case rate per 100,000, and that's less than 10 per 100,000. They don't identify a specific number. There's still, I think, is some concerns with DHS about when the numbers are too small, identification of folks that might be impacted. So nevertheless, this is data that we now did not have before. This is BASD from a year ago, and I'll go kind of quickly to this next one that shows BASD on top of Central Racine County Health. It just does show that we do tend to mirror that which we see in Western Racine County, which is the agency that we work most predominantly with as we kind of move through the system. Another, just kind of FYI, we've had some questions that were asked of us just relative to our schools, ventilation, whether or not we have air conditioning in schools. As you know, in this building, there's some parts, all of the new Karcher, but otherwise this goes through and explains the kind of filters we use, how quickly we recycle the air, and what some of our processes are across the school district. A little bit of kind of what we know about this Delta variant that everybody hears a lot about, and frankly, what we hear is pretty high level, pretty sort of speculatory, frankly, relative to what comes from DHS or Central Racine County Health, the two partners that we talk to most frequently. And you can see that it's not a great level of detail. So in terms of level setting as to what we know know that it's being said to be more contagious, and that it appears to carry a longer kind of lifespan, if you will, as a virus. But we don't know a lot more than what we've attempted to share on this slide. So we're still learning. COVID testing, it is something that was made available through some state funds in the spring. Right at the very, very end of the school year, it was announced that part of the federal dollars that were coming to the state were going to be allocated to schools to use for testing. So we've been following along that development. It's a rapid test. You can see a little bit of what is required here on this slide for us to do that. We've gone through those processes, and for somebody that may want to take advantage of this will just be another tool that we have. We don't intend to use it widespread, but it'll be for somebody that potentially comes in, says, I'm not feeling well, I've got symptoms, but I don't want to potentially go and have to wait to quarantine for the 14 days. This is what we know today relative to our protocol. I think that it's safe to say that this is right now what we know. Basically, the summary of this is that folks that are symptom-free and fully vaccinated, today we don't have to do any kind of quarantining, which is great for those folks. What this does highlight, though, under the close contact, is that this second bullet, both parties wearing a well-fitted mask, being 3 or 6 feet apart, we're still being told that that's a 14-day quarantine. I don't know how long this will last, and certainly you'll hear as we go through the rest of this presentation and in your discussion tonight, certainly it would be something that we could use to say we would encourage people to wear a mask if it does then avoid the need for you to quarantine. That's not currently sort of the rule that we're being told to follow when it comes to quarantine, but are hopeful that that is a possibility that comes down the road. A little bit on just communicable diseases, because I think we've all talked ourselves sort of to death relative to COVID, but it is good to know that really the school district's position on this is no different than that of when we dealt with other sicknesses. So for example, the measles, if there was an outbreak. We have 2 policies, one about immunization, one about communicable diseases. And our long-term strategy here would be to be consistent, that if COVID is with us for who knows how long, that we're able to treat that just like we would treat smallpox or any other communicable disease. As was said earlier, we do work with a number of different departments, mostly locally. Some of the ones listed here, including CDC or American Pediatrics, those are national organizations. And again, out of transparency, it's just important to know that here's what these recommendations from these organizations are saying. And that guidance is guidance, and guidance, as we know, has changed in certain instances and from some of these organizations. But we do monitor this just about every day, frankly, relative to what is being recommended for schools. For extracurricular, we get questions about this all the time. We have folks that are paying very careful attention to the WIAA and any guidelines that they have. But I think specifically, it is important to know that the general rule of thumb when it comes to athletics is when we then travel or people come to us, the agreed upon protocol will be that you'll follow whatever rules will exist for the host school. So if we are traveling to another community and that community is mask optional, then we can be mask optional in that community. If we're going to a community that requires a mask, then we have to wear masks while we're in the community. So that is what is being agreed upon in terms of people moving back and forth for athletics. And so just wanted to share that as an update as well. When it comes to face coverings, we know a couple of things. One is that there is a federal order currently that does require masks on mass transit. School buses are included in that order. That's an order from the federal government. It is set to expire in the fall. Don't know what will happen with that, but that's well after school starts, and so we will continue to monitor that as well. We do know that when it comes to mask wearing, it certainly reduces quarantine numbers because the rules around quarantine now say that if you have a mask on, if you're both wearing a mask, both parties, you don't have to quarantine. Don't know if that rule will stay or not, but that is the rule today. And we had in the presentation that you saw last month, we just had a lot less illness last year. Don't know if that was mask related or not, but there was a lot of other illnesses that were far less than in prior years. Our reality is that, as we said earlier, those core values and those core priorities remain the same. Both student learning and mental health is definitely a priority for us. We recognize that this hasn't been easy on our students, it's not been easy on our staff, and certainly we want to do everything we can to produce an environment where kids can thrive. We also recognize we can't control what happens outside of school. So a number of cases that we wrestled with last year were situations where it came to us from events that were outside of our schools. It's also a celebration for me that summer school and summer rec, we had no COVID cases in the duration of those programs, and masks were optional for the entirety of those programs. We also know that it can be very difficult to enforce mask use and proper mask use in particular, especially when you can't be masked in certain parts of the day, specifically including lunch. So it would be our recommendation, at least for consideration for board discussion, that we begin the year with masks being optional, and kind of with caveats is what's indicated here, that we understand that, back to the Swiss cheese analogy, that this is all dependent upon other mitigation strategies that we have in place so that everybody can continue to be in school in person and do so in good health. Then we would encourage students to have a mask with them. In some ways, it's kind of like carrying a student ID. I know that for many of us, as we go out and about and engage in different activities, we just carry it with us. It's just something you've now got in your possession in case you find yourself in a place that it's required. And then certainly, I think perhaps of most importance, this is something we may need to revisit if, in fact, whether it's Racine County rates that climb, or specifically if within the school district, if we have cases that spike or an outbreak of COVID in the building or amongst buildings, school buildings or classes or something where we would need to then say, we've got to take the extra precaution of wearing masks. So that is potentially that we would have to revisit that. We also then, I think, if in fact, it were decided that we would begin the year and not require facial coverings, we would still certainly want to say, look, we want to do anything we can to ensure that we can continue to come to school in good health. So for folks that are able, we would certainly recommend or encourage people to pursue vaccination if that's an option. We would recommend or pursue that people wear a mask if they're willing, if they're able. Regardless of those things, we would want all of our students and staff to just be responsible and considerate of one another. That if you choose not to wear a mask or you choose to wear a mask, that's your personal choice, and you do it accordingly and sort of allow folks the space to be as they are. And then just that we will remain aware, that we'll continue to pay attention, we'll seek reputable information from our folks in healthcare, whether that's at the state level or the county level, and we'll certainly do all we can to just monitor progress, because I think that's where we were at last year. We were able to stay in person, all but for just a very short window right around Thanksgiving, where we studied virtually for about 10 days. Hopefully that won't be the case, and that we won't need to go there, but certainly understand that that's a possibility. And then in closing, again, just that we know this has been difficult. We recognize in all of our buildings it's been a challenge for kids. We want to continue to express our compassion for our students and this journey that they're on, which none of us had to experience. The same for our staff, that they're having to reinvent the very way that they operate to communicate with students that might be here with them, might be online in another space. Also that we're committed to continuing to work with our local health department, and that's whether we opt to follow a recommendation that they make or work with them to look for other solutions. But that we want to continue to be partners with them, and we're committed to that. And then finally, that we just recognize it's fluid. We know that we're proud of how comprehensive our offerings here are in the Burlington Area School District. And we know that we can do the same when it comes to solutions relative to this situation as well. So that's just a kind of a high-level overview. Again, not too deeply into the weeds, but wanted to share some of that.
All right, thank you, Steve. That was excellent. I guess at this point, too, the board entertain a motion to decide whether for the start of the school year, we're going to make masks mandatory or masks optional.
I'd like to make a motion that the Burlington School District move forward with mask optional for the 2021-2022 school year for all students and staff, and that the Burlington Area School District will not mandate vaccines for students and staff as a condition of entry to any school district building, function, or condition of employment, and that any future decisions regarding masks will be approved by majority vote of the Board of Education.
All right. Motion been made. Do I have a second?
I'll second that.
Okay. Motion been made and seconded. Discussion, please.
Well, I do have a couple of questions. Steve, first of all, you say we're going to revisit this if the Racine County COVID rates climbs. So do you have specific numbers here, because the rates have been doing nothing but climbing?
What I can tell you is that what we've been told is that at least sort of a benchmark has not been set. But that number that gets tossed around out there is 250 per 100,000. So that doesn't mean Burlington Area School District, it means the county, essentially Central Racine County, which is west of the I. And so that is more than Burlington, frankly, but there's nobody that's put their finger on that number. And so I'm not sure that we would be able to really follow Central Racine County as much as we'd have to follow really what is going on within Burlington schools. or our community. And part of the struggle is that there are so many people that move around that it's hard to trace the numbers. So I guess the real answer is I don't know what that number is, what that threshold is. But I know from our experience last year, it was a reasonable tipping point where we felt like we just couldn't operate. And so we would probably watch either staff absences or student absences, and that would become the driver.
Yeah, I was gonna ask you what your contingency plan is. So you're saying to look at if there's a lot of student absences due to COVID, what will you do if there is a student that gets COVID, or if there's several students who get COVID, or a teacher gets COVID? What do you plan at that point?
Much of that would be how it was last year, where we have teachers who are essentially running simultaneously a Google Classroom as they are teaching. And that is one of those things where our threshold to manage that only runs so deep. And so if it becomes really widespread, we can't continue to maintain that, then that would have to be, at least per this motion, what I would need to come back to the board and say, we have to do something else.
Well, the COVID rates have been just going up the roof lately. 1 month ago, there were no cases of COVID in Racine County, and 1 month later, which is August 16th, there's 98 cases. It's rising so quickly. Now, in last February, there were 12 cases, and we masked. So if we masked when there were 12 cases, why shouldn't we mask when there's 98 cases? It just makes sense to me. This variant does spread very easily in children. I just saw something this morning showing that from the week of July 29th to August 5th, there were 94,000 cases, and this is in the country. And this week, there's 121,000 cases of children getting the COVID. And the thing is that this variant spreads so easily that it's just so disturbing to me. And then the CDC, the American Academy of Pediatrics, everyone makes the same recommendation. And the latest recommendation is due to the circulating and highly contagious Delta variant, the CDC recommends universal indoor masking by all students age 2 and older, staff, teachers, and visitors to K-12 schools regardless of vaccine status. So it's just, all I want to do is to keep the kids safe. And it just seems that this variant is just so volatile that the best way to do it, I feel, is to mask, is to have masks for students and for staff too.
Okay, but if you actually look at the numbers for 53105 zip code, municipalities that are within the Burlington area school district, I think the people that live in our district have done a pretty responsible job in terms of self-mitigation, self-control, personal responsibility. I think that these folks will do it again. So, if you look at the death rate since March 15, 2020, in the municipality of Lyons, there was less than 5. Spring Prairie, same thing. City of Burlington, there unfortunately were 28. Town of Burlington, there were 12. Dover, Kansasville, there were 19. Rochester, less than 5. So, total, school district-wide, within our boundaries, there's only been 45 deaths, unfortunate deaths, because of COVID. Yeah. So, and then if you look at the age groups, and this is the same, these numbers haven't changed since we talked about this at the end of April or May. When you, again, talking about death, ages 0 to 9, no deaths statewide. 10 to 19, there were 3 statewide. 20 to 29, that's not our responsibility.
One death is too much.
Yeah, of course it is, but we need to move forward, Susan. We have to, we can't continue to, continue to do a 180 and circle back on everything. We have to move forward.
We need to keep safe.
Call the question.
Taylor, you asked to call the question, we vote on whether to call the question or not. So,
That request to be roll call.
can I say something? Taylor, could you reread your motion one more time? Because there was a lot in that, and I didn't quite catch everything, so that helps me.
Sure. Make a motion that the Burlington Area School District moves forward with masks optional for the 2021-2022 school year for all students and staff, and that the Burlington Area School District will not mandate vaccines for students and staff as a condition of entry to any school district building/function or condition of employment, and that any future decisions regarding masks will be approved by a majority vote of the board. So I think that encompasses what Steve mentioned, that if numbers rise, we'll need to revisit and talk about this again. I don't think anybody debates that or has an issue with that.
I guess I'll say this, I think the term, I think I know what you're saying. The term moves forward, I think it's a little ambiguous. I prefer to say starts the school year. That'd be my 2 cents.
So would you like me to amend?
Well, I guess, as far as the discussion goes, the third part, I think, I also have a potential issue with, is that the board would be the only body that could make this decision. And our district policy on epidemics and pandemics specifically says, in certain situations, district administration, like it did last March, has the ability to make decisions in urgent situations. So I think the motion, I'd like to, personally, I'd like to see the motion amended to just address the start of the school year for mass. That'd be my preference, but I guess I'd like to hear some of the board members. Yeah, so I guess let's have a vote on calling the question. Toby, can we do a roll call on, this is just whether to call the question, so everyone makes sure we're clear. Whether we're moving forward just on a vote on Taylor's motion as stated, not amended. Yeah.
If the Western Racine County makes it mandatory, we don't have a choice as a board, we don't have to vote the board because we're trumped by Western Racine County. Area, right?
Sure. State or county or,
Federal.
yeah, we make a mandate and, yeah.
So that,
We're lower on the pecking order.
right, so I mean, if it comes from Racine County, the motion, it doesn't matter what it is because we're going to be trumped.
So again, we're asking to call the question, to vote whether to cut off debate and whether to vote on Taylor's motion as, as stated originally. So Toby, we do a roll call on that. No.
Marlo?
Yes.
Taylor?
Yes.
Kevin?
Yes,
Roseanne? Yeah. Susan? No.
So debate can continue on Taylor's motion. Anyone else have comments?
Yeah, I've got a couple comments. This is gonna be a tough one in general. I think people need to realize that this isn't a left issue, this isn't a right issue. This board's function isn't to cater to any one of the students, to keep them safe and provide them a great space. The priority of this board has to be to get these students in the classroom. The safest way to do that is to ask them going in. So my concern, particularly with Taylor's motion, is it is broad and unspecific. We already mandate to require vaccines to enter schools. We do unless you have a religious exemption. MMR? Gotta have it. I'm sorry, we're not taking public comment. We already mandate these things. If you want to amend your motion to not require, or to make masks optional, and leave it at that. I'll let that go ahead, but the motion as it sits, no, it's too broad. Takes too much power away from administration that they already have by policy, and it goes against things we already do.
Okay, I'm for making masks optional at the beginning of the year, and then see what happens. It's indicated in the presentation that you may come a time when we have no choice, just order to do that. So I think that it could just be a simple motion to start out optional, and then if necessary, with a caveat that then we have to go with masks, we'll have to.
Certainly can. I would counter the wrong time to close the barn doors after the horses ran away. We don't wait until we've got a problem to try and address it. We should be addressing it forward thinking. Because we want to keep these students in classroom learning. We don't want to have to pull everyone out. We don't want to have to go virtual. We want to shut down because we don't have enough staff.
I don't disagree with that. Or I think that our people have been very responsible in our community, and they want their kids in the school as well. They don't want them home. They would rather have them in the classroom. We have 84.5% of our staff vaccinated. They're serious about it. I think that we leave it to the people of our community to choose whether they want to put a mask on their child or not put a mask on their child, or whether they want to wear one when they go to Menards or not wear one when they go to Menards. And if they choose, if it rises, it's out of control based on the numbers that are out there, then we have no choice. But they want their kids in school too. We want our kids in school.
The public sector, which we're constantly told we should be emulating, is telling people masks.
I understand.
We're forcing employees to mask. We're forcing vaccination, which I'm not for. According to the Standard Press, approximately a week and a half ago, 45% of people in our district area are vaccinated. That's less than Racine County's average. So when we say we've been responsible, I don't think that's showing that.
Arlo, you have some comments?
I do. I just looked up the MMR, and that did have FDA approval. This current vaccine does not. It is EUA. Me personally, I'm not going to get it until it's approved. Simply because if there is a chance that I am that guy that has an adverse reaction, I need somebody to hold accountable. I don't feel comfortable forcing an employee, staff, a student to get vaccinated just to enter the building. Just speaking to Taylor's motion. I am all for people having their option to choose as they see fit, with the hopes that they are going to be responsible. My work requires that I wear a mask when I leave my desk. I do so. If I don't have to wear a mask, I'm gonna distance anyway because that's just who I am. But it should be left up to the parents to make that choice for themselves and their family.
Does anyone else have comments?
I'd like to just, to be clear, I'm not suggesting we force this current experimental vaccine on anyone to enter the building. Taylor's motion is any vaccine. It is not specific. That's my concern. So that's my hang up there. And yes, I have to ask as well. Right. So I get it. And no one likes to do it. The hope is to keep people in the building. And when people make the choice not to mask, if you make the choice to smoke in your own home, you're impacting your own home. You walk into a school building and choose to smoke, you're impacting more people than that. If you choose to come in unmasked, you're not impacting yourself, you're impacting everyone around you. So I appreciate the idea of people should have a choice, but that choice doesn't just impact them. impacts far more than that. And from what we've seen, I'm not convinced that's in the best interest of students. And that's what I'm concerned about. Do I want to wear a mask constantly? No. Like you, Marlo, I wear glasses. They clog up constantly. But when they're needed, we need to be worn. And we want these students to succeed. And that's going to happen in the classroom. That's my take.
Any other comments from board members? Discussion points? I guess I'll just say something briefly. This is a really very difficult decision. I think there's points on both sides, and in some ways we're making a decision here, at least for the start of the school year, that is the lesser of two bad options. I have listened, and we carefully read all the emails we get, so I want to make sure that's clear. I consider the points made in the emails, but I've also looked at other factors, health data. At this point, I'm in favor of making mask optional to start the school year. And see how it goes. But I think we should also tailor. I think the motion was a little too broad. We got a good point. When I'm looking at our policy right now on epidemics and pandemics, I wouldn't like to see us make a motion that isn't directly goes against that policy. So I'd love to see us amend the motion to talk about what we're going to do for the start of school year with masks. I think that's what parents need to know now. I don't think there's ever been any discussion anywhere at the school about making masks or any vaccinations mandatory. So I'm not sure if that's needed. But at least I'd like to leave out the last part of your motion because I think it's challenging. Last March, COVID hit, and we needed the administration to act fast. That's why our policy gives the administration in urgent situations to make immediate decisions. The only thing I know about this pandemic is we just don't know. We can't predict what's going to happen. So that's where I think we'd be unnecessarily hamstringing ourselves if we require board action, which takes time. We have to call a meeting, we have to notice it. We may need quick action in the future. I hope this goes away and it goes down again like it was, but I just don't know.
I move to amend the motion to read making masks optional for the start of the 21-22 school year.
All right, do I have a second on the amendment?
Second.
Okay, a motion to made and seconded on the amendment. Is there any discussion just on the amendment itself?
So the motion, the amended motion that would completely wipe out everything that I made the motion, correct? And we would just be going straight with masks optional for the start of the school year.
Yeah, I think it kind of takes the first part of your motion and amends it to just include that part, but it makes it clear that it's not moving forward, it's more precise for the start of the school year.
Okay, so we're going to talk about broad motions. What's the start of the school year? I mean, are we talking about just the semester, the first quarter? Okay,
First day of school, I think.
okay, sure, but it's fine. But then we can make a decision, or somebody can make a decision then on day 4 without board approval.
Absolutely. We got 300 students up 2 weeks in. Absolutely. Move. That's what we're saying.
So I guess the whole issue, or not the issue, the whole reason I made the motion that I did was because I don't want to have us get into a situation, because this is a concern by staff, definitely by staff members. I know because I talked to several of them who said we do not want to be forced to vaccinate. So I mean, I would hope that the school district would not cross that line and leave it up to a personal choice. So my whole thing is I'd like us to move forward mask optional for the school year. I'm fine with making changes to my motion, but because again, as you said, we need to move forward. So, I mean, we already got a motion in a second to that, so that's kind of where we're at.
I'll say this too, I have confidence in our administration that they've always come to the board when time permitted. And I'm confident, knowing our administrative members, that they're not going to make a decision lightly, capriciously, quickly, when the time permits. But there could be a situation where if cases went through the roof, I'd want them to be able to take quick action. And that's what our policy allows. So it's just proven. Any other discussion of the amendment? So, Would someone read the amendment? I don't know if you have. Toby? Okay, and Barry,
Yes.
agree.
I just have that masks will be optional for the Burlington Area School District students, staff, and guests for the start of the 2021-2022 school year.
Any other discussion? Yeah, is that satisfactory? Okay. All right, to follow correct procedure, we need to first vote on the amendment. So I guess Toby, we need to do a roll call on the amendment, so,
Peter,
yes.
Barry,
Yes.
Marlo,
No.
Taylor,
No.
Kevin,
Yes.
Roseanne,
Yes.
Susan.
No.
Okay, the amendment passes 4-3. And so the motion's been amended. Now we need to have a vote on the motion itself as amended. I guess I can go over discussion, but I think we may have beaten this horse pretty well. Any other discussion? I'll give one more chance. All right, hearing none. Toby, will you do a roll call on the amended motion?
Peter,
Yes.
Barry,
No.
Marlo,
No.
Excuse me, wait, I have a question. What are we voting on exactly?
This is the motion that Toby just read, so it was as amended, so,
The amended motion,
yeah, essentially in a
not
nutshell.
Taylor's motion.
No, not Taylor's motion. The motion's amended now, so it's just to start the school year with mask option.
Okay, thank you, sorry.
Marlo,
Yes.
Taylor,
Yes.
Kevin,
Yes.
Roseanne,
Yes.
Susan.
No.
Okay, so the motion passes. So I think that concludes our agenda item on that one. We do have a second agenda item. It's to elect a representative for the Wisconsin Association of School Boards for Region 13. So I guess I'd entertain a motion for nominee for the elections.
Make a motion that we nominate Roseanne.
Second.
Okay, motion's been made and seconded. I'd like to start with discussion. Roseanne has served as our nominee for the Wisconsin Association of School Boards. Furthermore, she's taken a leadership role above and beyond her work here on the Burlington School District. In fact, she's in the beginning part of a 3-year cycle where she will end up being the Wisconsin Association of School Boards president. So Roseanne, I appreciate your service and above and beyond all the work you do here for our district. I would like to take a minute just to read Roseanne's bio, which I think is relevant. Roseanne has served on the Burlington Area School District for 13 years. She served as president and clerk and served on many committees. She is elected director for Region 13. That makes her a member of the WASBA, that's Wisconsin Association of School Board of Directors. She was recently elected as the second vice president of the WASBA Executive Committee. She also has been appointed as a member of the Professional Standards Council, which works with DEI. Roseanne was an educator for 35 plus years. She also taught classes at UW Parkside and Carthage College. World Peace Through Understanding is the motto of the program that chose Roseanne to serve a year in her Hawaii, South America. It was an experience of a lifetime, and she's still a member of that group. Roseanne is a local piano teacher, tutor, church organist who loves her family and is proud of her therapist son and her 102-year-old mom. So, anyone? Any other discussion points? Comments? Hearing none, I guess I call for a roll call vote again. Toby, can you?
Peter,
Yes.
Barry,
Yes.
Marlo,
Yes.
Taylor,
No.
Kevin,
Yes.
Roseanne,
Yes.
and Susan.
Yes.
Thank you.
All right, thank you. The motion passes. Congratulations, Roseanne.
Thank you very much. It's always fun for me to represent Burlington because we have a lot to brag about here. I know last year when we went into the hybrid, I brought that up at a meeting, and a lot of the schools followed that pattern after we talked to them. So it's a very wonderful thing to belong to. I thank you very much for your, giving me the opportunity to.
Again, I'd like to thank members of the public for coming out to watch our meeting and support us and be present here. It's important to be, the communities involved in the school board district, the school district business. That being said, I guess I'd entertain a motion to adjourn the meeting. Okay, motion's made and seconded. All in favor, say aye.
Aye.
Opposed, nay. All right, we're adjourned.